Feeling the burning, urgency, and discomfort of a urinary tract infection is bad enough. But what if it keeps coming back? It is incredibly frustrating and can leave you wondering what is going on. When you experience recurring urinary tract infections, your doctor will likely order a series of specific tests to understand the underlying cause. The most common initial tests include a urine culture to identify the exact bacteria, and sometimes a post-void residual check to see if your bladder is emptying completely. Recurring urinary tract infections mean more than 2 infections in 6 months, or 3 or more in a year. The why behind these tests is to pinpoint why your body is susceptible. A urine culture helps choose the right antibiotic. If that does not solve it, doctors may explore further. They might use imaging tests like an ultrasound of the kidneys and bladder to look for structural issues, such as kidney stones, blockages, or an abnormal bladder shape that could trap urine. A CT scan, or computed tomography scan, might also be used for a more detailed view. A more invasive test, called a cystoscopy, involves a thin scope to look inside your bladder for problems like inflammation, polyps, or foreign bodies. Sometimes, urodynamic testing might be performed to assess bladder and urethra function, checking things like bladder capacity and pressure during urination. To help your doctor, keep a detailed log of your symptoms and when they occur. Note any patterns, such as if infections happen after certain activities. Be prepared to discuss your medical history, including any previous urinary tract infections or other health conditions. During these tests, you might be asked to provide urine samples, lie still for imaging, or have a small scope inserted. Remember to ask any questions you have about the procedures. Understanding the precise bacteria from a urine culture is crucial for targeted treatment, avoiding broad-spectrum antibiotics when unnecessary. Structural issues like vesicoureteral reflux, where urine flows backward from the bladder to the kidneys, can also be identified through these tests and corrected. These insights go beyond just treating the symptoms; they aim to solve the root problem. Working with your doctor through these comprehensive tests provides a clear pathway to identify the root cause of your recurring urinary tract infections. This allows for a more effective and lasting treatment plan, significantly improving your comfort and overall bladder health, and helping you move past the cycle of repeated infections.